Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. Spitting up is very common in newborns and young babies, but it can be very distressing to new parents. Today we'll be talking about everything you wanted to know about normal spitting up versus vomiting in your baby and what to do about it. So click those like and subscribe buttons and stay with us. Spitting up is very common. In fact, up to 3 months of age, 50% of babies will have some kind of form of spit up or GERD where the stomach contents come back up. This is because the lower esophageal sphincter, this is like this little round muscle that goes at the top of the baby's stomach, is immature or loose. This allows for the stomach contents or your breast milk or formula to come up through the esophagus, allowing for spit up to occur. This can happen for a variety of reasons, including changes in position or being too full. Many parents are concerned about spitting up and they think it's dangerous for their baby. So spitting up is normal and it usually does not interfere with your baby's well-being. Your baby will grow normally and the spitting up will usually stop by 12 months, but it's normal to see it even for less time. When a baby spits up, they can spit up as much as 1 to 2 mouthfuls of liquid formula or breast milk. But just so you know, it's very easy to overestimate the amount of spit up they have. You can't look at the stain on their shirt because over time the stain actually gets bigger. Many parents frantically call their pediatrician saying that their baby is vomiting when it is actually spitting up. So spitting up is the easy flow of stomach contents through the mouth. In fact, a lot of times it'll just be dribbling out of the baby's mouth. And spit up oftentimes happens with a burp. Vomiting is painful, it's forceful. This is when the stomach contents shoot out of the mouth, oftentimes inches away from the baby, again, versus dribbling down the side of a baby's mouth. Please remember to hit the like and subscribe buttons so you can get our latest content. There are many causes for spitting up. Overfeeding the baby or feeding the baby too fast are the most common. But other causes can be stuff like swallowing too much air. Motion sickness also affects newborns and young babies. Being too active after they're feeding, like playing, can also trigger their gag reflex, and this is known by hearing them cough. Babies can be allergic or sensitive to the food in their diet, causing them to spit up. And some babies who are born premature have an immature digestive system, which allows for spitting up. Finally, because babies are on a liquid diet, it's much easier for them to spit up than when they start to absorb solid foods. Let's talk about some things you can do during the feeding to help stop spitting up. So for starters, you want to avoid overfeeding your baby. During the feeding, take time to burp the baby. If your baby spits up a lot, you may want to burp 3 or 4 times during the feeding, like after each ounce of formula or breast milk. Make sure the nipple size is correct on your bottle. If a nipple size is too big, the holes are too big, then they'll drink too fast. If it's too small, they'll swallow air. Both of these can cause spitting up. Keep your feedings calm. Reduce distractions, feed in a quiet environment. This reduces the risk of your baby moving around during the feeding, which can cause spitting up. And finally, you may want to change your diet if you're breastfeeding or change the formula as there might be something that your baby is sensitive to. Let's talk about what you should do for your baby after they're feeding to avoid spitting up. Keep your baby upright for 20 to 30 minutes after the feeding is complete. You don't want to put your baby immediately into a swing, but after 10 or 15 minutes, you might be able to use a swing to complete that 20 to 30 minute time. Make sure you're putting your baby on their back to sleep. even if you are worried about spitting up, because this avoids the risk of SIDS. This is one of the biggest things that happens as a risk factor for SIDS, is that babies are spitting up, and so parents put them on their stomach. What you want to know about this is the tube that your baby spits up from is the esophagus. And when your baby is lying on their back, the esophagus is on the bottom. Babies know how to cough. The coughing reflex helps prevent them from choking. And when the esophagus is on the bottom and the baby chokes, the stomach contents will go back down into the stomach because it's fighting gravity. If you put your baby onto their stomach, the trachea, or the tube to their lungs, is now on the bottom, and all that formula can go down there. Finally, you want to make sure after your baby is done eating that you limit their active play, and don't put any pressure on their stomach, because that makes it easier for them to spit up. So try to avoid, say, putting them in their car seat, which puts that seatbelt on top of their stomach. In this video, we've told you how spitting up is not a concern and really can be normal for most babies. But you should be aware of some of the signs that this is not normal spitting up, and you need to go to your pediatrician. For starters, if your baby is crying for more than 3 hours per day or is very irritable, this is a big warning sign. You need to contact your pediatrician if your baby is not gaining weight or refuses to eat. If the baby is having less wet diapers, that's a big concern. Choking or gagging during the feeding needs to be addressed. And if the baby is spitting up fluid that is green, yellow, blood, or coffee ground looking, you need to have that checked out. Blood in the stool, difficulty breathing, a baby who seems sick, and if these symptoms start after the age of 6 months, make sure you contact your pediatrician immediately. I hope this video has helped you learn the difference between spitting up and vomiting and how you can prevent this in your baby. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family, and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.